Our next speaker is Dr. Shahala Nadaf. It is a great honor to introduce Dr. Shahala, a distinguished homeopathic consultant, academician, and mentor with an illustrious career spanning over 24 years. She is a former professor and HOD of the Department of Organon and Homeopathic Philosophy at Arihant Homeopathic College, Gujarat. Served as an assistant professor for postgraduate studies at Bhartesh Homeopathic Medical College, Belgavi. Former research coordinator at AM Sheikh Homeopathic Medical College, Belgavi. Mentor to students of the fellowship course in Homeopathic Dermatology, FCHD, since 2018 at Dr. Batra's Academy, Mumbai. We welcome Dr. Shahala.
Thank you. A very good morning to all of you. So today's case is a very simple case. I would not say simple, rather. It's a typical case which any homeopath would encounter. And today's case presentation specifically for all the students, because when you start your practice, like Dr. Asrani sir was saying, this is not only our, even I believe that it's not just bread and butter, it's a jam of the cases that we encounter in our practice. And most of the patients which come to us come with this particular, what you call, understanding that homeopathy is going to wean them off entirely from the allopathic medications, because the horror of steroids, bronchodilators, and no growth after giving steroids, all that, there are certain myths and certain real understanding also into that. So such a case had come to me. The whole family was my patient, in fact, and so it's just unmasking one of the respiratory challenge. The nosological diagnosis, what I would understand at this moment after retrospective studying, is basically bronchial asthma, acute exacerbation of chronic bronchial asthma. So this patient was Master ND, age 7 years, was studying second standard, and like I told, the whole family was my patient. The father was a businessman and the mother was a homemaker. So the patient complained. They first gave me the history of what was happening, because at the time when he came, he was not having typical acute exacerbation of symptoms of asthma. They said, we want to shift from allopathy to homeopathy, and that is why we have come to you. Okay, so they gave me the history that from 7 to 8 months of age, he used to continuously get thick, white nasal discharge. He had dry cough, would sit and bend forwards while coughing. No history of fever in the previous episodes. He used to always get aggravated wet in the rain, aggravated by cold drinks at night, aggravated lying down, and the frequency of this particular recurrent cold and coryza. Like I told you, patients come to you with this symptom that my child has recurrent cold and coryza, do something to build up the immunity. So that is the watchword today that we hear from our patients. And fortunately, we are blessed to be in homeopathy to give them that particular desire of having a good immunity with our medications. So duration, would the patient would have this particular complaints only for 3 to 4 days. So since now the things that had come to me, okay, present acute complaints were, this patient had breathlessness, would get up from sleep with cry, restlessness, aggravated after 2 a.m. This was a very prominent modality, and he was only relieved by bronchodilators. So he required hospitalization once in August 2023, sorry, it's not 24, 23, for breathlessness and high BP and no edema. So this high BP thing was not very clear because I didn't have the discharge card from the mother, but she said these were the symptoms which were there. So since 1 month, he was daily getting thick yellow nasal discharge, dry whooping cough, okay, and no breathlessness. So aggravated morning, aggravated going to bed. As soon as the head touched the pillow, he would actually start having this cough symptom. So on examination, when I saw this patient, he had the throat mild congestion, and left tonsillar hypertrophy was there. Tongue was clean and moist. Right cervical lymph nodes and were enlarged. Chest was clear. The teeth were serrated. Now I've just given these details especially for the students, because that is how classically we teach you all to take the case and prescribe upon. But many times as you advance in your practice, we tend to forget, at least while presenting these particular examination findings, which are actually very important, because when we tell we are helping you to helping the patient holistically, we need to understand the physical examination, the clinical presentation, as well as bend of mind, how we are going to approach the case homeopathically. Okay? So physical generals, when I took the case, the patient had reduced appetite right from beginning, not only during the episodes. He had aversion for vegetables, a typical symptom what a child has. Thirst always less, he had always candy thirst. He had craving for spicy things. Sweets was a question mark because he had craving for particular sweets of gulab jamun and other things not so much. Cold drinks, ice cream, history of pica. So why I said this is a typical case, because sometimes we don't get the typical symptoms, but then we have to arrive at a conclusion of a constitutional remedy, or we want to give an acute remedy. So today's case, I just want to demonstrate that sometimes, like in organon also, we are taught that when you have an acute exacerbation, touch the acute symptoms first. And then when the phase what you call expires, you can go for your constitutional treatment and carry on the treatment, especially chronic disease. But today's case is a little bit different. I have got acute remedy, but since somehow I was very comfortable with this case, and since he was already what you call not having acute exacerbation when he met me, I directly went to a constitutional treatment. That's I'll try to explain to you how. Okay. So sleep was disturbed due to the cough. He used to laugh during sleep. Salivation during sleep was very marked with this patient. Yeah. Thermal modality, he was a chilly patient, basically always liked the fan full and AC in summer for a while. Room is closed at night, thin bedsheet till waist, and he prefers tepid bath always. Dislikes cold water bath, but so getting wet, the aggravation of RS symptoms, which was very prominent, I've already told you. And the physical generals, he had hepatitis 2 years back, gastroenteritis when he was 8 days old. And in family history, we have one strong family history that the grandfather was hypertensive and he had heart disease and asthma. So milestones were almost normal. Birth weight was 3.2, teething 7th month, walking 10th month without support. Speech was a little late according to the mother because the elder child was quite, the younger sister, sorry, was quite fast. So words were not clear till 1 year. And he used to put his fingers in mouth, bites nails. This was continuing even at 7 years of age, okay, when he had joined school. So mothers, now here, since we always tell our students that you need to take the mother's history also, and since I told you I had the what you call liberty of treating the case at my own pace, okay, I did not hurry up. I actually went through the mother's history also, and I'll tell you why. Okay, because when we approach holistically, I'm not saying every case needs this approach, but when you get a chance, we need to go through the classical way of prescribing. So the mother's history was, it was very clear, and she was my patient earlier, so it gave me more what you call help to take the case of the child. Desire to lie down, uneasiness during first trimester. At 7th and 8th month, this mother had headache, which was aggravated due to heat of stove, smell of cabbage, emulated after sleep, and she used to get emulated after vomiting. And for the first 3 months, she used to get angry because of headaches. And she used to get angry, and a very sensitive individual she is. So with that headache, she used to have repentance after the headache. And she would strike her head on the wall later on, okay, because of repentance. Okay, so this was the mother's history during pregnancy when she was carrying this 7-year child, Master Ellie. So mentals about this child was, the child is quiet, curious, restless by nature. This is very marked. I could see with my clinic also. Memory is good, grasping good. First standard 98%, second. So academically very well accomplished child. But he had this typical fear of dark, especially after watching horror movies, which he would not stop watching. Okay, goes and does not share his toys with his sister. Had a typical sibling rivalry too. Fights with her, but shares with other children, but not with her. Okay, and gets angry when teased, would cry loudly, screams, beats his sisters, stares when scolded. Okay, so like I told you, the picture, if you see the acute presentation, by now you all also must have guessed, कि Drosera was coming because I aggravated 2 a.m. very clear, okay, and spasmodic cough, like a whooping cough, aggravated lying down as soon as it touches the window. Because when you are in rush in the practice, generally you think, okay, let us give, the child is coughing now, not very serious, no spasmodic, let me give Drosera. So even I was tempted to do that, but I just thought the child is coughing and I just had to wean him off the bronchodilators from the next day. So I just told the mother, I'll just study the case, so please come after 2-3 days and we'll manage with warm water and other things which you're managing. Or after 2 days, I'll give the medicine. So Drosera was thought of an indication for spasmodic cough because of 2 a.m. lying down as soon as the head touches the pillow. Okay. And generally, when we have the seasonal episode, especially a place like Belgaum, we know certain remedies act in a very profound way at that particular time. Okay, so Drosera, Hepar Sulf, Dulcamra, these are very commonly remedies that we use in our practice, whatever totality the patient throws at that time. So totality of case, let us go through. Nosological diagnosis, asthmatic bronchitis. Okay, they did not come with me with any particular diagnosis, but then in homeopathy, though we say we don't need diagnosis, but to know the prognosis, at least we need to understand what is the diagnosis. So according to homeopathy, it's a chronic disease with acute exacerbation because from 7 to 8 months of age he has it, and today is 7 years old. So fundamental miasm, I would say psychosis, because family history of asthma in the grandfather and getting wet, spasm, cough, breathlessness. Characteristics, mentally the child is very sensitive to scolding and teasing, cries after that. Jealousy, does not share a toy with his sister. Now I'm not telling the whole story, but this was very profoundly mentioned and understood when I took the case. So fear of dark, ghosts and restlessness also was marked. So physical genders, as we already seen, craving sweet, spicy, ice cream, cold drinks, and physical particulars, if you go back to the history, it's getting well, cold, clamant, breathless is 2 a.m. So pathological particulars were yellow, thick nasal discharge, spasms of cough, sits and bends forward during breathlessness. And mother's history, as we all know, headache, aggravated heat, stuffs, heat, smell, headache causing anger, then repents and strikes head to wall. So approach of the case, to solve the case, any case, one may take any of the approaches like I told in the beginning, suggested by our masters like Boninghausen, Kemp's or Bogas. All of these represent nothing but how to implement Hahnemann's direction to sense characteristic and arrange them to erect a portrait. So entry point may be any, but it should make a totality. That is the aim of everybody. Why I'm repeating this? Because with so many schools and so many ways of prescribing, which none of them we can say are wrong or partially wrong for that matter, but it's an approach. But this is a typical old method which, because most of us are students here, I'm trying to put it. So the integration helps us to understand the qualitative understanding and makes matching of the disease and drug picture a little easy. Okay. So this is just understanding, I hope, in a nutshell, what a holistic treatment of a particular case would be. So repertoire references, I've taken Frederick Schorens, okay. So sensitive to reprimands, jealousy, fear of darkness, fear of ghost, craving for sweet, spicy. I've got 3 different repertories on my this thing. Kent's is a very common use, but as I've advanced in my practice from the last 24 years or so, I'm trying to explore others, especially Fartek's repertory and other things. And looking at physical particulars, spasmodic cough, aggravated lying down, aggravated 2M, Drosera does come in mind, okay, even with this totality. But the typical mentals with physical generals, the miasmatic background, which is purely psychotic, and pathology with characteristic modalities, that is totality of case leads us to 1 to Medorim. So Medorim 200C, 4 pills. I given the pills form, 1 dose was given, and after few days the child developed a rash on hands, which was dealt, the mother already had dealt by applying some anti-allergic lotion by the mother. I did tell her, you are my regular patient, I told you never to apply any local application, but fortunately it didn't interfere my case. I mean, the symptoms were not in any way what you call smashed. So cough and breathlessness after ice cream, that was one of the things she mentioned the child had after taking your medicine. So Medorim 201 dose was repeated. 16/3/23, mother commented that for the first time since so many years, that is from the age of 7 to 8 months, his cough has reduced much and he could sleep peacefully, even miss school the next day. Then 30th, again Medorium 200C 1 dose because he had cough after eating ice cream, she complained. So on 2nd, again we had a follow-up. It was a regular follow-up which I had called. The child had cold, cough with yellowish greenish discharge, no dyspnea, but in general the patient was better. Medorium 201 dose again repeated because I didn't find any change in the symptoms and the aggravating factors were the same. Remained much better after this particular dose, as third dose, and the mother did not feel the need to report because the child felt better. So then on 2nd, 12/23, after a few days, the patient again came back with thick greenish yellow nasal discharge, had cough. He commented that he doesn't want to be a doctor in the future as he does not.
2 minutes more.
Yeah, done. So this time he was given Medorium 1M 1 dose. So far, though infrequently, many doses of Medorium I was giving him, but which relieved the symptoms apparently for a long time. So now, considering that the state of susceptibility, Medorium 1M dose was given, okay, because it was heightened at the moment. So much better till now, has spasmodic cough. Mother was very happy about the marked improvement of child's and mental health and also the general behavior of his jealousy and restlessness and etc. So Medorium 1M 1 dose repeated along with SL. So cough ameliorated completely, cold was on and off but very mild. By mistake, mother gave him daily 1 dose of Medorium stock what I had given her. Then considering it has an overdose of Medorium 1M, I did not repeat anything, just gave him Saclac for almost 9 months. And patient till date is apparently better, no acute attacks of RS. Mother came alone for follow-up on 2nd because I wanted to present one of these cases. I brought down some cases, but this case I felt should be this thing. And as he had exam, was thanking profusely and was full of gratitude towards homeopathy. So conclusion, this case highlighted following points: complete symptoms even of physical health, helps to prescribe well if we take the proper approach to solve it, to control temptation to prescribe sector remedies. This is the point I wanted to make, with proper preference for source books of Materia Medica. Worth noting Dr. Boga's studies in the philosophy of healing, where he says, unless acute disease become dangerous, okay, or throws upon the screen some indigestic indication, it should not be interfered with. Okay, don't rush for the sectorial remedies or just because we are dealing with acute exacerbation. Ultimately, the constitutional remedy peculiarly is bound to reveal itself in form of pointing delay clearly to its remedial counterpart. So conclusion is similar remedies can deviate susceptibility. Okay, so better to confirm if you have the luxury of time like what I had in this case, which was not an acute emergency when they came to me. Totality only gives confidence to prescribe rather than characteristic symptoms. And intrauterine life force may present itself through its host, that is mother. If so, then it helps to understand evolving constitution and disposition, which was psychosis in this particular child. Okay. Thank you.
Thank you, Dr. Shahala, for a very interesting and excellent case presentation.